The CDC says that most skin cancers are due to too much ultraviolet light exposure, which comes not only from the sun, but also from tanning beds and sun lamps. The agency advises everyone to avoid rays from those sources as well. Joining us now with some expert advice on how we can keep our skin healthy this summer is top New York City cosmetic surgeon and dermatologist, Dr. Ariel Ostad. Thanks so much for coming on the program, Dr. Ostad. It's great to have you.
Thank you, Sherry. I appreciate so much your invitation. I'm grateful to be here with you.
So clearly, the best way to avoid problems with your skin is prevention, including staying out of the sun and avoiding artificial UV rays. But if someone has been overexposed to the sun or used tanning beds in the past and now has serious damage, what are the best options for them?
So that's a great question in terms of what the best options are when somebody has a lot of sun damage. It falls into really what we call medical as well as laser treatments. One thing that has been shown through repeated studies is actually taking a vitamin called niacinamide. Niacinamide is a vitamin B3 molecule that's safe to take. Vitamin B3 has been shown to actually be able to repair DNA damage. There's also studies that niacinamide can actually be an anti-aging molecule. And that's something you can purchase over the counter. It's niacinamide, not niacin, which can cause flushing. So that's a simple thing one can do.
When it comes to skin cancer, you are one of the top and most sought-after Mohs surgeons in the world, and also a spokesperson for the Skin Cancer Foundation. We can see you here co-chairing the Skin Cancer Foundation Gala event. Can you just describe what the Mohs procedure is and why your method is considered to be so superior to others?
I would love to do that. So Mohs surgery is a technique that was invented back in the 80s by Dr. Frederick Mohs that revolutionized the treatment of skin cancer. Prior to the advent of Mohs surgery, skin cancers would be treated with what we call wide local excision, which would leave people with a lot of deformity. The advantage of Mohs procedure is that we can actually very conservatively take a small rim of healthy tissue around the skin cancer, primarily in difficult to treat areas such as, let's say, the nose, the eyelid, the ear, the face, hands in this case. And basically, by taking a very thin layer, we can immediately examine that piece under the microscope, where we can evaluate 100% of the edges, 100% of the bottom of the tissue. And therefore, it allows us to be precise in making sure all the cancer is removed. Prior to the Mohs, you could not really evaluate 100% of the margins. You may have missed potentially areas that had cancer in it. So with this method, we're able to not only check all the periphery, all the bottom, leave the patient with the smallest possible wound, which means a better cosmesis, but also just the accuracy of removing the cancer is better. So not only it preserves a lot of normal tissue, it allows us to be very accurate. So the cure rate is higher than any other modality out there.
Just amazing. Those before and after photos are incredible. Well, we also just reported about how important it is to not only use sunscreen, but also to apply it correctly. Is there any additional advice you can give our viewers about application? And also, what are the best products to use? The latest report says that mineral and spray sunscreens are on the rise. Are they both safe?
And it's such an important question. I appreciate that you brought it up. So in terms of what are the best sunscreens? The best sunscreens are what we call mineral-based sunscreens, meaning sunscreens that contain what we call zinc and titanium. Those are basically have the highest filter ability, where it blocks the sun's rays. That's one important aspect. A lot of chemical sunscreens, which is what you find over the counter, I would say comprises about 90% of sunscreens out there, are chemical-based sunscreens that contain what we call avobenzone, oxybenzone. And there's a lot of controversy about those ingredients because there's more and more studies that show that these products in animals are what we call hormone disruptors. They can actually influence one's hormones. They can potentially increase the risk of uterine cancer in rats in the laboratories. And to answer your second questions about sprays, I am not a huge fan of spray sunscreens because I find that, first of all, when you spray it, a lot of it gets out into the atmosphere. A lot of spray sunscreens tend to be chemical sunscreens. There's a potential for inhalation of sunscreens. So there's a potential for what we call lung issues. And lastly, it doesn't kind of stay on anyway. So it's better to use ideally a lotion. And the key is to apply it liberally.
Are there any sunscreens that you recommend specifically that you use or recommend to patients in your office that have some of the ingredients that are really effective and also are safe?
Skin cancer formation is not purely due to ultraviolet light, which is sun. It's actually visible light, even indoors, can actually lead to cancer. And there are more studies because and that makes sense clinically because I have patients who say to me, I'm just like never in the sun. As a kid, I've never been in the sun. And I believe that visible light, the fluorescent bulbs that are basically indoors, can lead to skin cancer formation. So and general sunscreens don't protect against visible light. So you also want to incorporate a sunscreen that has what we call iron oxide that blocks visible light. And that's something I've created in my practice I'm very proud of. It does create a tint to the sunscreen, which actually is nice because it matches patient's skin type, skin color.
Well, lastly, for people who want to preserve their youthful appearance, especially after suffering sun damage, but who don't want to undergo invasive plastic surgery per se, are there some other options that you can offer them?
Sure, absolutely. So one common thing is there are creams that one can use as baseline at home for just some maintenance improvement. There are products that contain what we call high concentration retinoic acid. So that's something that does give you a bit of improvement in terms of getting rid of hyperpigmentation, sunspots, just helping with stimulating collagen. But the most effective are laser treatments. You see pictures of before and after here. And one of the workhorse lasers in my practice is what we call Fraxel laser. It's what we call a non-ablative laser, meaning the recovery is minimal. And basically, we were able to get rid of a lot of sun damage. It's actually been shown to reduce precancers, reduce the incidence of skin cancer, but it has cosmetic benefits as well in terms of creating a youthful look.
Thank you, Dr. Ostap, for explaining all of that so well and for all of that excellent advice. It was great to have you, and we look forward to having you back again soon.
Thank you so much for the opportunity. It's truly a privilege to be here for your audience and try to do what I can to educate them. Thank you for the opportunity.
Take care. Thanks.
Thank you.